Hello everyone! Today we are going to talk about urinary tract infections. So have you or a family member ever felt a burning sensation or had a strong continuous desire to urinate? Have you ever had a high fever and pain in the flank region? Well, this condition is called urinary tract infection, and it is a very common condition normally. Your urine typically doesn't contain bacteria, but in urinary tract infection, it is an infection in any part of your urinary system, like your kidneys, ureters, bladders, and urethra. In this video, we will explain to you everything related to this infection, what it is, symptoms, and how to diagnose it and treat it. So our role today is to answer most of your questions regarding urinary tract infections. Today we have Dr. Yoon, who is a leading doctor at Ewha Seoul Hospital. She's going to discuss with us everything about urinary tract infections from an experienced medical point of view. Hello, I'm Uma, and before we start, please subscribe to our channel so the next time you will be updated with our new releases. So, chronic urinary tract infection. What is it and what causes it?
Usually when we say chronic, it is a condition that lasts over 6 weeks. Urinary tract infections, or UTIs, are infections of the urinary tract that inflames and causes problems in the surrounding areas. This condition lasts over 6 weeks or occurs constantly after treatment. The most common is chronic inflammation of the bladder. We consider it chronic if it occurs 3 or more times a year or 2 times within a 6-month period. Actually, we all have bacteria in the bladder, but UTI happens when there's a lack of immunity. The reasons why immunity drops are varied. First is if the urination habit is bad, such as too frequent urination, or if urination is stalled voluntarily too much, or if the urination amount is too low. All these actions lower the immune system of the bladder. If bacteria enters the area, the ability to flush out with urine lowers. Also, other reasons such as diabetes or neurogenic bladder, or the presence of a catheter full-time, the possibility for infection gets pronounced. Actually, the high-risk group is women, more specifically menopausal women. These middle-aged women have lowered hormone levels, prone to E. coli infections, a weakened bladder, frequent need to urinate, etc. In any case, if bladder infections are not treated promptly, they can turn chronic easily.
So how do you diagnose this and then treat it later on?
Chronic UTIs can be treated first with antibiotics. Also, there is a UTI that can be treated without antibiotics. Those are UTIs that originally resulted from infection, but due to the condition, inflammation continues. Those can be treated with pain relievers, anti-inflammatory drugs, and bladder supplements. So whether it is UTI or chronic UTI, the first step is a urine test. We must see if there is a presence of bacteria and if it is growing. And if so, we prescribe antibiotics. But there are patients who do not have bacteria but continue to show inflammation symptoms. For those people, we use anti-inflammatory drugs, just like we treat rheumatoid arthritis. However, since the bladder constantly plays the role of emptying itself of urine, the treatment lasts a very long time. For example, the chronic UTI's treatment lasts a good 3 months. Most will undergo a 3 to 6 month treatment. If we want to prevent UTI, we must first avoid it. In order to avoid it, we must urinate normally, with 3 to 4 hour intervals, or about 4 to 6 times a day. The urine amount should be generous, about 300 milliliters or so. If this is not possible, drugs can help to do so. Drinking too much water may not be best. The hydration should match one's activity levels. If we have a healthy 60-kilogram adult who exercises moderately, 1.5 liters to 1.8 liters of water a day is good. At minimum, 1.2 liters to 1.5 liters is recommended. Instead of drinking this amount at once or large gulps, it is best to divide the needed intake throughout the day, with the amount absorbed in a spread-out manner. This is the most important way to prevent the occurrence of UTIs.
So last question, what's special about the Department of Urology here in Ewha Women's University Seoul Hospital.
Ewha Women's University Hospital's advantage is that we have very focused specialties. For urological disorders, we have separate specialties that care for men and women. I specialize in women. We have the ability to look at men and women's issues separately and be more focused on each. Also, we have ample experience operating through robotic-assisted methods for those who have bladders that have sunk low, affected by cancer, or hardened bladders leading to reconstructive surgeries. Through the help of robotics assistance, we can operate with smaller incisions and more accurately than older methods. And with the help of specialized tools, we can diagnose and treat prostate cancers with precision. And with the aid of MRI, we can increase the precision of diagnosis. All these advantages separate us from other hospitals.
감사합니다. Thank you, Dr. Yoon.
Thank you.
So today we learned many things about urinary tract infections, and the doctor explained in details everything related to this common infection. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.